Welcome, everyone. Welcome to the semi-plenary session organized by the Dahdaleh Institute for Global Health Research at York University, proud co-host of this year's Radboud Conference on Earth System Governance. I am delighted to welcome everyone, and good afternoon for those who are in the room here, and good morning, good afternoon, good evening to everyone who is joining us via Zoom. The theme of today's semi-plenary is integrating planetary health within Earth system governance. This semi-plenary is an essential component of the 2023 Radboud Conference on Earth System Governance. The panel is organized by the conference's co-host, institutional co-host, and it will be an interdisciplinary space to delve into interlinkages between climate, nature, and human health to explore the integrated governance that is needed and that should be effective and equitable. In the face of the inextricable interdependency between human, animal, and environmental health, and the Earth's natural systems, it is a very important moment for us to speak in detail about how planetary health can be part of our Earth system governance network and advance our interdisciplinary collaborations and research, not only interdisciplinary, but also transdisciplinary. That is between disciplines as well as between academic research and stakeholders. My name is Idil Boran. I am from York University, the Dahdaleh Institute for Global Health Research. There will be further introductions, but right now I am very pleased to invite Ina Lehmann, assistant professor at the Vrije Universiteit Amsterdam, and the Department of Environmental Policy Analysis, who has graciously accepted to chair and moderate this session. Ina is specialized in governance of global biodiversity. We have had multiple occasions in which we collaborated. Ina is a dear colleague and friend, and her expertise is very much at the heart of what we had hoped to achieve today at this conference, but also today at this semi-plenary to talk about planetary health and Earth system governance. And I would like to also highlight that Ina, during the pandemic, has worked on the interconnections between the habitat loss and zoonotic diseases, another really important key entry point for our topic. So then we have a great semi-plenary for you today. Without further ado, I turn over to Ina. Ina, you have the floor.
Thank you, Ido, for this very kind introduction. It's my pleasure also together with Idil to open this semi-plenary and maybe to also give a very, very brief content-wise introduction, because that will of course be done by the speakers, but just for everybody to have a bit of an idea of what we're talking about. So according to the Lancet Commission on actually planetary health means the health of the human civilization and the state of natural systems on which it depends. So very broad. And actually, within this broader framework, there's a wide range of approaches, methods, and so on that can be applied. And also, there are multiple threads, we think, that weave this theme together to maybe a fabric, you could say, of planetary health governance. And for this semi-plenary, we have invited 5 different experts on different areas of planetary health governance, and we have put 2 questions to them that we would like them to take up in their presentations. And the first question is what they see as the main threat, or threats maybe, as indispensable elements of planetary health governance. And the second one, it's more of a task to them, is to identify the key, concrete and accessible priorities for the ESG community to integrate planetary health into the efforts to bridge science and society for transformations to sustainability. So that's the task we have set out to them. And from there, I will just move on to present our first speaker, who's Professor Sharon Friel. She's Professor of Health Equity and Director of the Menzies Centre for Health Governance and Director of the Australian Research Centre for Health Equity at the Australian National University. She has published extensively on diverse aspects of health equity, and she has recently acquired a major project on planetary health equity, and I think she will be presenting some of that work. And together with her team at the Planetary Health Equity Hothouse, I love that word, or that wording, she aims to generate what they call new ways for good health for all within the context of a stable, sustainable ecosystem. And they work through academic research, but also, I think, with a lot of civil society engagement. And well, we're looking forward to hearing more about that.
Thank you. Thank you so much for the invitation to be here. This is my first time to ESG, and I absolutely intend to come back. It's been marvellous. So yeah, let me just start my wee clock. So 3 slides. We were given the task of 3 slides, no more. So what do I want to say in 3 slides? And apologies, some of you, this will be the 3rd time you've seen this, some people in the audience. So the way I have always come at this issue is the intersection between climate change, social inequality and health. And the motivation is there is no biological reason for the differences in health outcomes, human health outcomes, that we see between countries around the world and among populations within countries. And for many, many years, there has been extensive research looking at the connection between social inequities and health inequities. And then more and more evidence has accumulated, certainly in the past few decades, that really is pointing towards the way in which climate change is exacerbating global health inequities through the pressures on social inequities. And so to do anything, the question is, if we're to do anything about the equitable enjoyment of good health, we must do something about Earth's system. And I'm particularly interested in climate change. And so for us in the hothouse, we speak about planetary health equity or planetary health inequity as the sustainable enjoyment, the equitable enjoyment of good health in a stable Earth system. And equity is the core element in there. So what that means is we have to think about the common drivers of both climate change and social inequities if we're going to do anything about global health equity. And the way we articulate that is the consumptogenic system. If we're going to do anything about planetary health equity, we have to address this system of institutions, of policies, of commercial activities, of social and institutional norms that absolutely bake in, that incentivize, reward the excessive production and consumption of fossil fuel goods and services, which of course are incredibly bad for the environment and which are often very unhealthy and very unequally distributed. I just came from a marvellous session where we were talking about the fossil fuel industry, a key aspect of the consumptogenic system. So I think we've got to do something about the fossil fuel industry if we're going to do anything about global health equity. And so, of course, as soon as you start to talk about the consumptogenic system, you're getting into the politics of health and health equity. So how might we examine this system? How might we examine the politics and the power inequities that exist across that system? And so what I think a progressive research and action agenda could, should, must look like is the imagining and the embedding of a different paradigm, bringing health into the economic discussions, bringing health into the climate discussions, bringing health into the intersectoral discussions, and positioning health, social, environmental goals as the markers of societal progress. That's a new paradigm, the imagining and the embedding of that paradigm, and how to make that happen. Then the realising of state capacity. So in the conference, what I've heard already is a lot of discussion about policy coherence, policy integration. That's all about breaking down boundaries, breaking down the policy silos. And we do not have the answer to that yet. So we still need much more research that understands integration and coherence, and for me, in ways that pursue, support planetary health equity goals. It's also about the idea, I live in Australia, I come from Australia, and we have never really thought about policy legacies in a sense of it's short-term, it's reactive in terms of policy responses, it's short-term and reactive. So how do we understand, what are the conditions that enable state actors to actually work towards a mission, a long-term mission? And arguably that requires fit-for-purpose regulatory mechanisms. And then what I refer to as taming the beast. Part of achieving governance for planetary health equity means taming the beast that is the fossil fuel industry, that is the large agri-businesses, that is the large private developers that create infrastructure that is causing so many problems for the environment and health. And so what does a regulatory environment look like? What does a fit-for-purpose regulatory environment look like that actually embeds the social, the health and the equity, the environmental goals into these business models? And of course, there's some incredible movements happening within the private sector. And then my final remark really is, so both from a research and an action perspective, is understanding the role of social movements, understanding the strategies and the practices that enable the elevation of planetary health equity, social, environmental health goals into the political, the policy and the public discourse. We know that change happens when there is very loud, very noisy and very organised civil society that helps governments to take the steps that are necessary to do everything that I've described above. So I hope that's some provocations for the politics, really, of achieving planetary health equity. Thank you.
Thank you, Sharon. And thank you for this obviously perfect timing. That was really on the spot. Together with Edil, we agreed that we will have all the presentations first and then have a discussion with all the audience of all the presentations jointly afterwards. So it is my pleasure now to introduce James Orbinski, who is professor at the School of Global Health at York University in Canada. He's also adjunct professor for clinical public health at the University of Toronto, and he's the inaugural director of the Dahdaleh Institute for Global Health. And what is really interesting is that by training, he is a medical practitioner, and he has really devoted much of his career to humanitarian action, to working in crisis situations, in situations of war and famine, and has long-term served as he was long-term with Médecins Sans Frontières, where he was also the international director between 1998 and 2001. And also as an academic now, he promotes equity and transdisciplinary research, and he has worked on modeling the equity impacts and the health impacts of climate change. So we're very curious to hear from you. Thank you.
Okay. Well, thank you very much. So we've been given very tight parameters, 3 slides. So I've kind of cheated a little bit by embedding moving images in my slides. But we've also been given a very tight time. And now, obviously, planetary health as a concept is a very powerful concept, and there's much nuance to it, in the same way that Earth systems governance is a very powerful concept with much nuance to it. And what I'm going to present, what I hope I will present, is just what I think are the core elements and why planetary health is important. So typically, when I first heard the term Earth system governance, which I heard some years ago, it invoked for me this sort of image of non-human governance. So governance of issues that are outside the realm of human space and activity. And I actually heard that term referenced in a session earlier this morning, that there's a distinction between the human and the non-human world. And so for me, planetary health, where's my slide? Yeah. Planetary health is a framework for research, policy, and practice that actually recognizes not the interdependence, but the dependence of human civilization on natural systems. And it does so with a view to engaging what I describe as critical problem solving for greater effectiveness, equity, and excellence in global health research, policy, and practice. Now, the concept that was already referred to was originally within the health community or the health disciplines. The concept was introduced in 2015 through a Lancet Commission report, which was based on at least 2 years of very deep study by a transdisciplinary academic and policy and political collectorate of commissioners. And they published this in the Lancet in 2015. And it outlined the concept of planetary health. And the concept is essentially what I've just described. It's the dependent relationship of human civilization and human civilizational activities on natural systems with a feedback that implicitly recognizes that human civilizations and our activities can affect the natural systems on which we depend for our very being, for our very viability, and for our very life. So that's the core concept. Now what I'd like to do just in my time is talk about a very concrete example of that. This is an image of Cyclone Freddy. And it's an image that's taken from the NASA Space the International Space Station, which includes NASA and others, the International Space Station. And this is an image of the cyclone as it impacted Malawi in March of this year. Now, in Malawi, it had been impacted by a cyclone in December of the previous year. So only 4 months previous had it been impacted by a major, major cyclone event, which was a national emergency for several months. And in March, the consequences of Freddy also evoked a national emergency, which is not just of several months, but is actually ongoing today in terms of the impacts and consequences. And this was against a backdrop of the massive impacts already prior to the cyclone, both cyclones, of climate change on ecosystems within Malawi. And the image here, in a certain sense, should tell you everything. This was a lake. This was a lake, Lake Chilwa, in the early part of this millennium. Now, 20 years later, this is now the lake. And this is a direct consequence of evaporation and other factors, but evaporation being the major factor driven by global warming and its impact, obviously, on water volumes in the lake basin. Some months after Cyclone Freddy in March of this year, this is the ongoing reality of daily life in the Chilwa Basin of Malawi. And I took this photograph about 4 weeks ago. Now, I could give you 1 billion photographs that would demonstrate just how horrific and absolutely existentially transcendent the impact of both cyclones were on the community of people living in the Chihuahua Basin. But this photo demonstrates that daily life is deeply affected by the impacts of climate change, and not simply in the the impact moment in space and time of a cyclone, but in an ongoing way. There you are. So here's part of our team doing the kind of things that we do. Well, what we do is we are trying to model the health impacts of climate change in the Lake Chihuahua Basin of Malawi. It's been an ongoing project. We have many partners. I don't have time to put up a slide with all the partners and everything else, but many, many partners. And what do? Well, we try to understand, we use systems dynamics theory and agent-based modeling to understand the relationship between complex systems. And what we have done essentially is created conceptually and then very practically, we have modeled 6 subsystems. I'm not going to go through them all in great detail, but they're ecological services, extreme weather, food security, infectious diseases, disaster risk management, and clinical public health capacities. Each of those 6 systems are mapped here. You can see the 6 different colors, and you can see all kinds of loops, feedback loops, positive and negative, and everything else. This is a causal loop diagram. And what you see is that the 6 subsystems actually integrate into a totality, into a system. Now, what we've tried to do is to map the causal relationships of at least 400 different variables across systems to try to understand the impact of meteorologic change, climate change, black box, and then in what area? Clinical public health. And what very specific things? Food security, and then infectious disease. Food security, protein, energy, malnutrition, micronutrient deficiencies, kwashiorkor marasmus, the common diseases, common malnutrition disorders that affect children and, in fact, adults in the Chihuahua Basin. Which infectious diseases? Schistosomiasis, cholera, malaria, and dengue. Very practical diseases that people are practically concerned with on a daily basis. So we've tried to map the relationship between meteorologic change, black box, and then these health outcomes. And we're trying to say, what is going on inside this black box? Now, how have we done it? I know my time is limited here. How have we done it? Well, we have basically created causal loop diagrams, which I've just shown you, and then we've translated these into agent-based modeling parameters, and we have mapped and modeled those parameters, and then we've applied artificial intelligence and machine learning capacity to optimize our understanding of the relationship between these variables. And we are just about ready to finish the project, and hopefully that will give us a tool where we can help individuals, communities, and governments understand and then make adaptive choices to improve the health status of people as they are affected by climate change. There are many very interesting dimensions to what we're trying to do, but one that I really wanted to mention to you that's extremely important is that we use participatory methods, community-based participatory methods to parameterize, if you will, the specific variables and to ascribe value to those specific variables. And so this is objective, but it's also deeply community-based and based in the subjectivities of community. And so that is a very interesting idea, and this is an experiment. We will see if this actually works. I'm not sure yet, but this is an experiment, and I think it's an experiment worth doing. So we take an ecosystems approach to health. We use 6 basic principles, and I will just simply list them here. Systems thinking, knowledge to action, transdisciplinarity, participation, equity, and sustainability. But the one that is, the 3 that I want to emphasize that I did in a moment ago, effectiveness. Whatever we do has got to work. It's got to make not only rational sense, it actually has to be effective. Then the second most important principle is equity. We are focused on the most vulnerable people. And if you are able to impact the most vulnerable, you will, by definition, trickle up, if you will, into the central systems, whose failures, in fact, define the vulnerabilities of those who are most extreme. And then the third and the final is excellence. The idea that there's no second, or there's no two tiers here in terms of the rich, the poor, the black, the white, the science for Malawi versus the science for University of Toronto or wherever. We use one standard, and that's excellence, and that's the pursuit of the best possible interventions so that under a critical problem-solving framework for the integration of human civilizational realities within the broad paradigm of natural systems governance. So that gives you an idea. Thank you.
Thank you very much. That was truly impressive, I think I can say. And I'm sure there will be lots of questions afterwards. But for now, I want to introduce Professor Ebru Canan Sokolu. She's Professor of Political Science and International Relations at Bahçeşehir University in Istanbul. She's also the Dean of the Faculty of Economics and Administrative and Social Sciences there. And she has done substantive research. Now we're turning to another perspective on international crisis and public opinion, and all of that from her international relations background. And also she's the country leader for Turkey for CIFA, the Center for Training Leaders and Managers at the UN Institute for Research and Training, and with a specific focus on the SDGs. And I think she will also present some of her work on the internet connections between different SDGs. It's a pleasure to have you here, Ebru.
Well, good morning, good afternoon. Thank you very much for the invitation. It's a great privilege for me to be here. I learned a lot. And, well, I'm an IR person, as Ina just mentioned, and I've been doing research, working primarily with public opinion data. And my recent focus is on democracy and sustainability. And, well, what I would like to share my thoughts today are just in line with what Ina had drawn, threats and priorities. And, well, I'm not a health scientist. I'm not primarily working on Earth system governance from an academic perspective, but what we know is that it is it's an indispensable part of what we deal with as our scholars in our studies. What are the threats? Well, the threats, when you study threats are mostly perceived either through sociotropic dimensions, basically threats that are distant to us, or egocentric dimensions, which we feel, in our daily lives. And so depending on what type of threat is this, we develop different preferences and opinions towards any issues, not necessarily planetary health. And our topic today deals with also the governance issue, which actually is a two-way relation. It's a cyclical relation. There are different approaches to define governance. We definitely need to bridge the gap between the society and the governments or the decision makers, decision implementers. So we have this big puzzle. I agree with the multi-sectoral aspect, multi-level aspect of all these very big problems, which are sociotropic and egocentric to us. So, and of course, the second tier of my topic will be on priorities. And I'll try to offer at least the solutions from my scholarly interest perspective. So basically, well, humanitarian crisis is an integral part of what I understand from planetary health as an IR person. We know that there is an intricate web of connections between planetary health, Earth system governance, and the capacities to find solutions, long-term solutions, sustainable mechanisms to cope with the crisis. And, well, I'm coming from Turkey, and which is very distant to what people experience in their daily lives in this part of the world. Turkey is surrounded by a region which is in constant crisis. Not only, mass migration, wars, there are crises about water, there are crises about energy resources, so forth and so on. So that part of the world is dealing with different types of humanitarian crises, and we need to address also these crises in our understanding and work on planetary health. What is a dependent variable or an independent variable in this relation? I'm not very sure if you're studying the planetary health as a dependent or an independent variable, but apparently, whether your perspective or decision on which influences the other, we definitely need to take into several components. First one is, we heard a lot about environmental problems that is in the core, in the essence of the planetary health issues. Access to clean water, sanitation. We know that, I have some statistics here, we know that there are every day more than 800 kids die because of lack of access to water in different parts of the world. And 1 in every 3 does not have an access to water to drink. So this is a part of the humanitarian crisis I would like to remind. 10% of the world population is hungry. While infectious diseases, every day 16,000 children die because of curable diseases in different parts of the world. And also, 795 million people on a daily basis sleep without any food that day. So these are some scary statistics, and these are threats because we have talked a lot about diversities, equalities, and these are the important vectors of our understanding. They have to be. Well, of course, we need a holistic approach. We don't have to, and we cannot solve all these problems right now. Out of 90 countries in the world, there are these data available on UN websites. Out of 90 countries studied, 74 of them deal with at least 3 different types of crisis. So, what do we need? Well, first of all, of course, I said I'm a public opinion person, and, we know the statistics about the public awareness is very scary as well. So this is another threat. We don't know much. I mean, out of this room, we have to understand what people really understand or what they know about all these crises about, planetary health. I'm sure that there are millions of people who have never heard this concept before. And, of course, democracy. Well, democracies, SDGs 16 and 17 have some issues. We are talking about polarization in every sense of the life, and we need more, not more democracies in terms of frequency, but more, qualified democracies, because we're talking about governance. We're talking about the society, we talk about the decision makers, and so we need better democracies. We are academics here sitting in this room. We are together with young people, and the universities have an important role in not only doing research, but conveying the findings to the wider audiences and collaborating with the public and private sectors. So we have to use this power, because we are the agents of, advocacy, public awareness, we produce data, and so forth and so on. My concluding remarks, I'm very happy that I joined this year to this conference. Thank you very much again for invitation. But, I see a risk in the greenwashing of the concepts. We have to think about this, right? We have several, I'll just need 1 more minute. My research dealing with data show me some striking yet very well-known things, consequences. What we talk about is the problem of the educated people. We need to be more educated. We need to educate people. It's a problem of the young rather than the aging populations. And definitely it's a political problem. And we're talking about polarization, so it shouldn't be only left as a problem of the left. And we need definitely political awareness. I'll just conclude with one striking finding of my research, and it says what we should do on planetary health. This is the data, public opinion data that tells us. Well, people prefer that we need to take individual action. So what we are talking as planetary health, environmental problems, is something that individuals should take care of. This is a problem, isn't it? And secondly, we also, this is the transatlantic public, which thinks all these problems can be solved at international level, not at the local level. So governments in this list are on the bottom, right? We don't put any blame or responsibility to the governments to take an action. So, but then we cannot talk about governance, right? And I want to thank you all. I'm sorry I don't have any answers or solutions to all these problems, but I leave you with a lot of question marks. Thank you very much.
Thank you, Ebru, and I'm sure there will be opportunity to come back to address some of these question marks, maybe, or at least some of them. For now, I want to introduce Catherine Brown, who is a professor and deputy director of Melbourne Climate Futures, and also a professor of environment, climate change, and global health at the Melbourne School of Public Population and Global Health. She is an internationally recognized expert on both the science and the public policy of global health issues. She has published quite widely on these issues and has also regularly advised multilateral agencies such as WHO, I'm really sorry, UNEP and UNDP on these issues. And she, then that's maybe really interesting for us as well, is the lead author of the health chapter of the UNFCCC report. And I think you'll have a lot to say.
Thank you, Ina. Yes, the IPCC report, the sixth assessment report, our health chapter, had a great representation. So, yes, I was a lead author on that. Thank you very much for the invitation to speak today, and thank you, everyone, for attending this session. Let me just get this to work. Excellent. So what I thought I would do in my 7 minutes is I followed the rules around the 3 slides, and I'll zoom out quite a bit in terms of really talking about how we've seen governance evolve in relation to planetary health, justice in particular. So as the speakers before me, who were fantastic and I think really set the scene for my brief intervention now, we saw quite a focus on climate change, and so mine is similarly that way focused, but we do know that the concept of planetary health is much broader than just climate change, but I'm using climate change in my quick intervention here. What I thought I'd show you for your interest was the increasing publications we've been seeing in governance, climate change and health. You can see the red bars indicate governance and climate change papers that have been written from 2012 to 2022, so the last 10 years or so, going up very rapidly. And in the orange, you can see the health, governance and climate change papers slowly increasing as well. So it's really, it's a positive sign, but there's a lot more work that we need to do to really make sure that we're including the important elements of governance in the work that we do around planetary health. So far, it's been very nascent, and we're not, I don't think, at that point where we're rigorously examining the ways in which politics are occurring, or the ways in which decisions are being made, or, you know, Sharon's point around influence, I think, and power. Really, really vital elements for us to unpick in terms of our research priorities. So that answers one of your questions in terms of what are our research priorities. And it's not just about writing papers, as we know, and as we were reminded by Miriam in the keynote on, was that Monday evening or Tuesday evening? It's also, what do we do with these? We cannot just expect people to read them. We need to be making sure that we're speaking with policymakers, civil societies, the private sector clearly, and understanding where they see the research gaps as well, so that we can really collaborate and co-design and come up with impactful research in our areas. I wanted to also provide an overview on how health is increasing its profile in global governance processes. So as one example, the UNFCCC, we know in the Paris Agreement we have written in there respect and promote the right to health when taking action to address climate change. In the recent loss and damage discussion, health is included in the non-economic loss and damage component of those negotiations. The negotiations aren't clear on what this means for the health sector, but at least health is written in those loss and damage negotiations. In the Sharm el-Sheikh implementation plan that was finalised last year at the COP, it was that this was the strongest reference to health that we've ever seen in a COP. The human right to a clean, healthy and sustainable environment has been acknowledged. So that's a real win for the health community. And health is also represented in both the global goal on adaptation as well as the global stocktake. But they're only small representations, and there's no clear structured mechanism for us to amplify our voices as the health community. So we've got a lot more to do. In the COPs, so in COP26 in the UK, for the first time, the WHO had a pavilion and a 1-hour ministerial meeting, which is a great advance. But we also saw 50 countries sign up to the WHO's initiative to make health systems resilient and or reach net zero. And that number now, a couple of years later, is 76. So that's really great in terms of advocacy, and that's the signing of this agreement at the level of the health minister. So that's a really important indication at a national level in terms of health commitments. There was one mention of health in the final COP26 statement. In the year following, as I said, we had that human right to a clean, healthy and sustainable environment embedded. And this year, we will see the first ever health day at the COP. We know all the problems associated with the COP this year in terms of where it's being held in Dubai, and enormous issues in terms of the governance around that and the potential achievements that the COP will aim for this year. However, having a health day at the COP is a really big achievement for the health community. And this means that a lot of health ministers for the first time will be attending this year's COP. So the issue is for many health ministers that they haven't yet thought about how is climate change relevant to my portfolio. So there are a lot of discussions internationally to try and skill up the capacity of our health ministers globally to know what to talk about, to know what to bring to the table. So I'm involved in a couple of those discussions to support health ministers to be able to negotiate what is important for the health sector. And my final slide was just to I did have a couple of more points, but I think I'm running out of time. But the G20 has been really important as well in terms of increasing the profile of human health and climate change in particular. So the India presidency, as many of you might know this year, has been a very strong advocate for climate inclusion in the health negotiations. And this year in April, G20 governments discussed high-level principles for healthcare climate action. And so this has been important work that's been supported by the Asian Development Bank. And then finally, the World Health Assembly this year, there was the most discussion ever on climate change and human health at the World Health Assembly this year. And there's likely to be a climate and health resolution at next year's World Health Assembly. So we're really seeing some improvements in terms of the international activity around global health and climate change and governance. And so just to finish, I wanted to briefly talk about how health is represented in the NDCs. And so the WHO does annual analyses of how health is being represented in each country's NDCs. And the majority of NDCs now include health considerations. And with more than 2/3 are really talking about the need for a healthy and green recovery from COVID-19. But the issue is how are these health considerations being implemented? So we know that the NDCs flag the sorts of ambitions that countries have, but how these are being implemented, and there's very little information on how we do that. So I think more research on implementation as well, and really how do we support governments and countries to better develop monitoring, evaluation and learning frameworks so that we are actually implementing the sorts of activities that we heard from James that are going to make a difference in communities, local level, national level, and all in between, and international, of course. So with that, I think I'm just in time. Thank you, Ina.
Well, thank you, Catherine, and also thank you for providing us with some tasks that we probably can work on over the next years or so. Maybe we can discuss that with the audience, what they want to pick up. First of all, I want to introduce our last speaker. She has kind of introduced herself, but I also want to introduce Idil. She's Idil Boran. She's a professor of applied environmental governance and public policy at the Department of Philosophy at York University in Canada. And she's also a faculty fellow of the Dahdaleh Institute for Global Health Research. We've already heard James speaking. And she's also an associate director of CFAL York in this case, but we have also heard Ibra speaking from CFAL Istanbul. So quite some connections to draw here. Idil, interestingly, is initially trained in philosophy and political theory and political thought. So I'm sure she will also add another perspective, and has been working in, I think, last 10, 15 years on climate issues, also from a justice perspective. But she has also been very much involved with the political processes. I know that she has been organizing many side events at UNFCCC, COPs. And in the recent years, she's increasingly also venturing into the area of biodiversity and climate biodiversity linkages. So we're looking forward to your final words.
Thank you, Ina, for this kind introduction. And indeed, I have been active in the UNFCCC space, and we have organized many side events, and I couldn't have done these without my fellow collaborators at the German Institute of Development and Sustainability, IDOS. And in fact, they are also co-hosts alongside us of this year's conference. So a shout out to them as I open my remarks, which are going to reflect on the question that we were asked. We were asked to think about what planetary health should mean for Earth system governance and what could be done to enhance planetary health in Earth system governance. So in my role, also as speaking from the co-host institution, I see my role as taking this discussion into a higher, more broader level, and then driving into Earth system governance. So after we heard a rich arrays of insights that illustrate first of all, the multifaceted nature of planetary health and the many different ways in which we can deploy planetary health research and thinking, then what we have in front of us is the realization that there are multiple entry points. That planetary health, as we heard, the definition is wide. That means there are many different ways in which we can try to make sense of it. And so for me, and for my research, planetary health is the interlinked global crises and how we respond to it. The climate crisis, the biodiversity crisis, the pollution crisis, and their health impacts on ecosystems, on animals, on humans, but also their connection to multiple other issues such as food systems, water, and socioeconomic makeup of society. We heard about the importance of thinking about paradigm change. And so this is our opportunity in the way we integrate planetary health in this space. We can also think about how it can help us as researchers, as an international community of researchers, to really accelerate the change, the paradigmatic change that we need for sustainability transformations. Now, this is about, first of all, the health of the planet. So when we say planetary health, in its broad understanding, it's the health of the planet. I come from philosophy as a discipline, and I can see that when we say planetary health, there is something very broad, almost like a general concept that speaks about the circumstances in which we are with the multiple crises, not specifically about this kind of health condition or that kind of health impact, but the general state of the world that we are in. Now, that is one way in which we can think about planetary health as a concept. But the challenge with that is that there is no way of grasping what that could mean. Just for example, we often visualize, for example, our work. It's very common, and we work with data, we show slides, we visualize things, but take a step back and think about it. When we say planetary health, no matter how hard you look, you can't see planetary health. There is nothing that can be seen that we can pinpoint, saying this is planetary health. And this is the same thing about politics. We are all, most of us here in this space, we are political scientists or cognitive sciences. And same thing, no matter how hard we look, we can't see politics. We can see different aspects of it. We can see its functioning. We can see its institution, even its institutions. We can't really see them. We have to make sense of these concepts, and this is why I think philosophy, my home in my upbringing, can actually help considerably, because we need powerful concepts to make sense of these challenges that we face today, and we need to weave them really effectively, and hence again the metaphor of thread. We need to weave them with good data, with solid empirical work, with the latest science. So we have actually a very, when we think about it, we have a very challenging task ahead of us. So for me, this is what planetary health really means. It's the transdisciplinarity, and the transdisciplinarity that we are also currently working on in this space at Earth System Governance. Now, this is much more challenging than it seems. Because, first of all, let's talk about what, as a research community, not Earth System Governance, but as researchers, broadly speaking, that what we have achieved really well. There is something academic research has done really, really well, and that is internationalization of research. In fact, we are here as an example, as an illustration of an international community. And we have also come a long way in interdisciplinarity by fostering collaborations, bringing different multidisciplinary perspectives together. But there is still work in progress on transdisciplinarity, the way we can bring the different perspectives and voices that connect the research community with stakeholders, with society. In fact, the theme of this conference is also a sign that we are willing to make progress on it, that we are working hard also as a community to achieve transdisciplinarity, but we are still in a work in progress state. And in fact, I'm going to introduce, as I close, a concept, in fact, a distinction that many of us in this space use. It's the distinction between agency and architecture. So as agents of research, we are ready to make, to create groundbreaking work, and we have talent. We have also a dynamic environment. We have a youth group, the youth delegation, for example, that came here. And so we are agents of change for research, but we also need the support of a really good tailored architecture, an architecture of research that is going to allow us to maximize our potential. So that is still work in progress. Funding agencies continuously ask us now to engage with stakeholders, with the vulnerable communities. They provide funding, but the architecture, the research architectures within which we work, it still does not give us all the support that we need. And this is why the network like Earth System Governance is so important, because that is one way in which the architecture of research can be modified and can be enhanced in order for us to achieve the transdisciplinarity that we need. So then, all this to say that I applaud Earth System Governance, both for being open to the concept of planetary health here at Radboud University in 2023, but also I applaud the Earth System Governance for working on a declaration. I believe there is a Radboud declaration in the works, and so my most concrete and actionable recommendation to integrate a planetary health in this phase would be to think about including health and planetary health in the work of Earth System Governance as a formal component, but also to resist the temptation, this is for everyone in the community, in the research community, to resist the temptation to be too single-minded about it. So it's not about this kind of health issue, but or that particular approach to health, but rather all of the kind of a more holistic, as we heard, also holistic approaches, a holistic, a continuous effort to integrate holistic approaches that can respond to the health crises that the planet faces. And so on this note, I thank also the organizers, the volunteers, and everyone who is here. And with this note, I would like to hear, of course, about your suggestions on how we can work together to improve transdisciplinarity, planetary health within Earth System Governance. Thank you.
Thank you, Idil, for closing the plenary, and also, well, of course, congratulations, Idil, because it was really Idil who put together this plenary, and I think she did a great job at integrating different perspectives from different backgrounds, transdisciplinary working people, into one plenary. So thank you very much, Idil. With that, I would like to invite all the speakers to take a seat over here, and we'll have a mic for them. And also, I think we have some great assistants who can walk around with a mic so that you all can share your questions. Can I just give it to one of you? Thank you. And thanks to the good time management by all the speakers, we do actually have half an hour for questions and answers and discussions. And I would like to open the floor to see if there's anybody. Yes, I see the gentleman in the back. He raised his hand very quickly. Can we pass a mic to him?
Thank you very much.
And please introduce yourselves.
Yeah, my name is Peter Case. I'm professor at the University of the West of England and also have a chair at James Cook University in North Queensland. And for the last, well, more than a decade, I've been working within rural health and also the global health space with infectious diseases with a social science background. And I just wanted to comment really on some of the issues that were raised and applaud, the fantastic work that you're all doing. And particularly, James and his work with communities and trying to kind of elicit variables and so forth that are meaningful within that context. And in terms of this sort of overall challenge we face with transdisciplinarity and so on, something I haven't heard mentioned in any forum here at the ESG is the value of participatory action research. So a methodology that actually combines scientific research with communities at all kinds of levels. So if I could just give one example, I realise I shouldn't be giving a paper from the floor, and I don't want to indulge this, but just a very quick example of some work I've been doing in Zimbabwe, where one issue we've been looking at is sustainability in a healthcare system there. So working with the Ministry of Health and Childcare in Zimbabwe, I've been working there for many, many years, but in the last 3 years, working with HIV prevention. And so the government executives and analysts came up with a sustainability implementation plan. It had lots of variables, and it was a kind of barometer with checks and balances, the kind of typical thing that happens. But no one really thought to ask, well, does this actually mean anything to the people on the ground, right? So they're setting all kinds of targets which are meaningless, or not entirely meaningless, but were very difficult for people actually at district level and certainly at community level to understand. It doesn't mean things to them. Because, of course, this is very granular. What sustainability means is incredibly granular. So what's happening in the Malawi Basin is very different than what's happening in Matabeleland, for example. So how do we address this? We addressed it by multiple interventions at different levels within this broader system, using something I call system in the room, which is based on a psychodynamic model from the Tavistock Institute of Human Relations. So it's just putting it out there as potentially a very powerful methodology that can draw in many perspectives from scientists, from philosophers. I myself have a background in philosophy and anthropology. From obviously medics, pharmacists, you name it. We can broad community representatives, clergy, very important in the African context. Traditional healers can all be brought into a space to address challenges. Very powerful method. So just a comment, really.
I've got the mic, so if I may, I'll make a quick response and then I'll pass on to anyone else. Absolutely, participatory action research is fundamental to the sorts of global health work that I think many of us are involved with. So for the last 20 years, that's really been the key guiding perspective, I suppose, that I've taken. And I didn't have a chance to talk about that in my brief presentation. I didn't talk about my research at all. But so, for example, some work I did in the Mekong with 3 countries at a national right through to the village level was to understand what the determinants of risk for different communities were around health and climate change. And these were assessed by the local community, and then responses were created by the local community. And this was then finally produced in a national plan that had those sub-national indicators and was able to be then agreed by the national legislation and was seen as a really core policy document to then be able to support the implementation of those activities. So that's a very quick example, but absolutely agree the imperative of including all people who have a stake in the activity and understand different perspectives and agree that it's all very contextually different. We need to be looking at different responses in different locations. One other thing I'd add just before I finish is that a lot of my role in my research is supporting the building of capacity and capability of colleagues, both in Australia and mainly in the Indo-Pacific. So I want my role to be redundant. If I do a good job, I'm not needed anymore. That's what my ambition is. So my clear role in any of the projects I'm involved with is to make sure that there's a sustainability of any research or any sort of applied policy relevant work that I do. So brief reflections there.
I'm not going to comment on that particular approach. I suppose it's an important reminder for us of a fit-for-purpose approach to depends on the question. I certainly wouldn't adopt that sort of approach if we believe that we want to understand the conditions that enable the fossil fuel industry to stop doing what it's doing. I think we have evidence of that from another methodological approach. So it's just a reminder to us of, depending on the question and depending on the purpose of what it is we're trying to achieve as researchers or as advocates, then the method just follows the question. So thank you.
Well, thank you very much. I have actually just a couple of very brief points. I mentioned the role of democracy, and one type of democracy is deliberative democracy that we speak of. I mean, not the participatory action, but it includes. Because here we are an epistemic community, we know about the things, we discuss from very high level, research-oriented, data-based, perspective, all these issues listed in the conference program. But we have limits. And the limit is that, we have to convey the message. And the message through different disciplines, maybe there are different methodologies we follow, but still we need to communicate. We need to communicate, first of all, the students, the youth, right? And then we need to communicate with the local people. This is actually one critical aspect, that determines the success of all our work. Very short, memory that I can share with you. One day I was actually sitting with my friends who are, white-collar people. Some work in business sector, some work in governments, at around similar ages. And I was wearing a sweatshirt with a big sustainability wheel on it. And one of my friends, and this is like 1 month ago, one of my friends said, "What is this? Is it like an artistic, a brand?" I said, and she was working at Shell. I said, "What do you mean by that?" "This is about sustainability." "What is it?" Come on, are you kidding? Because, working at Shell and not having heard of sustainability was an impossible thing. And she said, "Well, I don't know much about this." And then other people said, "Oh, we don't know about it," and so forth and so on, right? And I was like getting shocked. I said, "Are you serious? Everywhere is full of these wheels, messages, sustainability. Even if you go to IKEA, you find a sustainable, whatever. Everything is sustainable there." So probably we couldn't bridge that gap. And I agree with your point about the participatory action. Small groups, qualitative work, that needs to be done. But first we need to understand what people know about this, right? Planetary health, Earth system governance. I'm sure that there are, thousands of academics, researchers, scientists who have never thought of these issues that we're talking about. So are they emerging to us? Are they our immediate concerns? So we have to make it immediate concern for the people. And there are multiple channels for that, and I agree. We need a methodology, as Edith said. We need a paradigmatic change. We definitely need it. 2030 or 2050 is just there. And if you consider that 6.5 billion people will live in mega metropolitan areas by the year of 2050, is a scary thing, and this is approaching. So we need to, hurry up in this regard. And I think the young people around this room are going to deliver this message. So we have to collaborate with them. Thank you.
Nobody has to pick it up, I think. If you're fine, Edith and James, then I think we have a lot of other questions in the room. I think the lady in the back was also very early. Maybe you can also introduce yourself and try to be specific, because you have 20 minutes left and there's many questions, I see.
Yeah. Thank you. My name is Romina Martin from the Stockholm Resilience Center, and my question relates directly to the presentation from James. I was wondering about the role of the ethics within the tools, within the generation of modeling tools. Since modeling is also my background, we are particularly aware of what part of the decision is boxed in by selling it as a tool, and which part of the decision is actually opened up for deliberation. So I was wondering how in the creation of the tools, ethical dilemmas were reflected upon, and how you foresee, when the tool is done, the interpretation of results can still be discussed in their ethical implications. Thank you.
Okay. So in the very first instance, the very concept of modeling the health impacts of climate change for the purposes of maximizing adaptation, that has embedded in it a whole series of ethical assumptions. So that's very important to recognize. And then my second, and I don't want to kind of go through all those assumptions, but I think that's very important to recognize, that the formulation of the problem has inherent ethical dimensions to it. And I think that's an important kind of realization, whether it applies to what I've described or whether it applies to Earth systems governance. I mean, it's actually within that concept, there are embedded assumptions and goals. The good. What is the good? We are pursuing Earth systems governance in pursuit, hopefully, of some better good than the reality that we have now. So we embedded in the formulation are a whole series of very profound and important ethical principles of practice. Second, which actually relates to the first question around participatory methods. I've referred to participatory methods as really important. The meaning of a question will vary across who is asking the question and who's seeking to answer the question. And this is why we are really exploring as thoroughly as we possibly can the application of community-based participatory methods to the valuation of different variables within the model that we're trying to create. So for example, a minister of health will have a very different conception of cholera and why cholera is important than a fisherman who is trying to catch fish, to feed his family in a cholera-infested lake, as opposed to a mother who is trying to get her kids to school and is worried about the pump outside the school building, and is that in fact contaminated with cholera? So the meaning of the question and the relevance of the question will vary according to who asks and who answers. And then again, embedded in that approach and the choice to use participatory methods is a recognition not only of that variance of meaning, but also of the different ethical parameters that apply to that. So I know it's a very theoretical answer, but I think it avoids, the kind of, in this setting, I mean, it avoids the description of these kind of algorithmic approaches to ethics. Well, we have this checkbox, we have, a consequentialist approach, we have a utilitarian approach, we have a virtue-oriented, whatever the approach is. The practical consideration of ethical values, in my view, is best pursued through a participatory methodology, because there's such variance in terms of the meaning of a particular question and therefore of a particular answer. And if you want to then objectify that, which is really what we're trying to do in this modeling system, you have to have you do in fact need an algorithmic approach, right, to the relationships that you establish among your variables. But you can change the valuation of each variable according to the subjectivity of the group to whom you have asked a question. Again, very theoretical, but I hope it answers your question.
Thank you. I saw at least 2 more hands up, and maybe we can collect them precisely. Stefan Bauer and Srinivasa Srigi, please agree amongst yourselves.
Well, thank you. Thank you very much once again for the excellent presentations and views. I think my question or my concern was also concerning what you just explained, James. It's about framing, it's framing the problem and Earth system governance, planetary health, excellent global discourses, putting things in perspective. We know the links between climate change and local health impacts and so on. But how do we actually, take this forward? How does it connect with the framing? The people are dealing with an existential crisis. You mentioned several of these crises. Do we really need this high-level framing to approach the problem, or does it even work? Because they may not even be able to connect with this broader level of framing. Be it any level of decision maker within the country, beyond subnational and below, levels below. Their planning horizons are shorter when it comes to governments. It's more the political economy-based decision making, and even people, who want to build a house or or invest in something. They're dealing with a lot of existential questions. So in this context, how do we actually make this work? This is excellent, but it's all connected. But how does it? How do we make this matter for the decision makers below?
So,
Okay, maybe we can collect Stefan's questions as well, and then play it back to the podium.
Yeah, well, I'd have many questions, but I'll stick with one, but not without congratulating Dahdaleh and York for coming on board to the ESG and hosting this semi-plenary, which was really wonderful and inspiring. So thank you for that. And the question I have probably goes to all of you, but it was prompted by Ebru's presentation, and I share your sort of sentiment that we don't necessarily need more democracies that check the boxes for being formally democratic, but better quality democracies. At the same time, you pointed to the threat and trend of polarization. It's very apparent in the US, but it's also happening in many other places that would be considered quality democracies. And so how do we deal with that, as it's arguably polarization, I would argue, is undermining the quality that we need, and it's very hard to get by and to deal with it. And so the question to all is, do you see a specific angle that the health realm, the health nexus provides us with to counter something against these polarization trends? Is health something that may be a common denominator across political camps, etc.?
Is there still a third question that we can include? Apparently not, so then it's back to the podium again.
So just in answer to the first question about framing, why does it matter? Is it relevant? It's absolutely relevant. It's highly, highly relevant. The impacts of climate change thus far are demonstrable, right? In just even the little images I showed you, right? They're deeply, deeply demonstrable. Greenhouse gas emissions today, even if we stop them at 5 o'clock this afternoon, globally, the impact of emissions from 4 o'clock will have effects for the next 30 years. And the trajectory of impact is up, right? It's increasing. So what we know is that for the next 30 years, we have a real problem, right? Even if we stop greenhouse gas emissions. So why does the framing matter? The framing matters because, first of all, in the context of the health system, whether it's Toronto or Zomba, Malawi, in the context of a health system, we need to adapt. We must adapt. There's no escape from that responsibility. The question is how? What's the most appropriate form of adaptation? And that's why in my particular case, I'm focusing in the way that I am in Malawi. So that's the first. The other is that it's not just that there are global phenomena that influence local reality in terms of health. Local reality creates the global phenomena, right? And in different ways, in different parts of the world. And we know the northern creation, massive creation and contribution in greenhouse gas emissions since the beginning of the Industrial Revolution to now has created massive impacts, not only in the north, but even greater in the south. But there are also impacts in the south, or activities in the south, that impact natural systems globally. And I'll just give you one very concrete example. In the area that I talked about, deforestation it's massive and it's overwhelming. It's everywhere. I remember when I first started working in Malawi in 2004, I'd drive along these dusty old dirt roads and you'd see these beautiful mountains that we treed and so on. Now those very mountains are barren, and that's only 20 years, right? They're completely barren. Now they're barren and with increased precipitation, that means runoff, it means mudslides, mudslides through agricultural land with this high nitrogen content, and that that soil runs into the remnants of the Chilwa Basin, causing eutrophication, causing an accelerated ambient environment for the proliferation of cholera, schisto, and a whole bunch of other diseases. So these are not unrelated phenomena. There's I don't want to say circular, it's the wrong word, but there is a feedback system of the global to the local to the global to local, and both are accelerants, right? So understanding those relationships and finding ways to communicate those through active health interventions, I think is very, very powerful. Not only conceptually, but it makes people happy. You know, I'm happy when I know that my children are not going to die of cholera, because of the things that I did. I'm happy, when there's better food, and I know that the way that I grow my food is not only better in terms of the food products and the quality of the crops, but it actually reduces, if I do it in a particular way, it reduces the probability of schistosomiasis, right? So now those understandings are on one level very complex, but they're actually very simple. And most people can do actually understand that if you walk them through a process where they participate in the learning and the construction of causal relationships in the particular setting I'm describing. So the framing really, really matters. Now the challenges of bringing that to a global perspective, and so those are important challenges. But I'm just trying to demonstrate, to you and to others, how important these very practical initiatives are. And with that, I'll pass the mic to others.
Yeah. I was just going to say, maybe we need to give the others a chance, and maybe we have 5 minutes left. If each of you can try to limit their answer to 1 minute, that would be lovely.
Well, thank you very much. Just, about the question on democracy. I mean, we just recently had a great seismic shock during the COVID-19 pandemic. It was not only the democracies like backsliding, but we were happy about the rise of the autocratic governments who were shutting the borders, who were, every day, twice a time, or in different countries, 20 times on TVs, telling us, don't go out, stay at home, do this, don't. These were all the autocratic rules, and we enjoyed because we had an immediate egocentric threat that was just at the, in our lives. And, I think we need a securitizing approach. We need frameworks for sure, but that was actually the moment where the planetary health, with the case of COVID-19, was securitized. And democratic backsliding, yes, democratic backsliding is a completely different topic. But we need actually decision makers who have to take care of the advocacy of the issue. Because we need systems. And individuals are not able to, provide mechanisms that are sort of implemented throughout a country, for instance, throughout the world. So we need mechanisms, we need a collaborative action, we need collective action, we need V-feeling for that. And, well, of course, there's a lot of democratic discussion related to polarization, so forth and so on. But I think we need to analyze more COVID-19 as a prime example and a case for the planetary health or for other disciplines here. So, yeah, thank you very much.
Just very briefly, great points. I think on the usefulness of planetary health as a frame, I'm ambivalent. For some people it's helpful, for some others it's not, especially in some countries where I work where the term makes no sense. It doesn't mean anything. It can't be translated. So I'm not sure that the framing of planetary health in that type of terminology is always helpful for everyone. So it's more about the importance of looking at our health and humans as part of our natural environment and how we're preserving and conserving and strengthening the world with which we are inherently part of, and that the health benefits that arise from that are vital for our survival. So it can be termed in whatever way we want to, or a particular context sees that it makes sense. So the term planetary health has been defined by The Lancet. The Lancet is a UK-based organisation that has particular values and principles that they adopt. So I just put that out there for consideration. I'm not dismissing the term at all. I use it when it's helpful. It's a very pragmatic decision for me. Sometimes it makes sense and sometimes it doesn't. And in particular, when I work with Indigenous colleagues in Australia, this term is quite insulting because it's coming across as a new term, and it's not a new term. It's not a new way of understanding the world. So I think we have to be very, very careful in understanding the importance of that sensitivities and the ways that this is not a new concept. Quickly, in terms of how health can be used as a policy lever, I think we're seeing this more and more in litigation, where being able to demonstrate the health impacts of a new coal-fired power station, for example, is now an important lever to stop the progress of such sort of investment. So that's happening slowly, but we're seeing health being used in more of the litigation cases around the world, and we've got some terrific colleagues at the University of Melbourne who do a lot of work around that, so I'd be happy to introduce you to them as well. But we're also seeing the UN Director General really highlighting the importance of health and action on health for sustainability and climate change.
Thank you. I've forgotten your questions. I'm sorry it took so long. I think your question really is about one of strategic communication. You make a decision strategically, depending, you frame it accordingly. But the importance of a conceptual framing is it shines a light on something. So, but again, it's a strategic decision when you might use the framing. The health nexus, I think what we're seeing is the use of well-being having important cut-through, and also from a child rights perspective, because the children who are not born yet will not be born unless we do something about the climate crisis in particular. And so the possible health and the well-being of our children is being severely compromised, which is really just also a point for me to finish on, to say we've had a lot of discussion about adaptation, and adaptation is incredibly important. Climate change mitigation, I would argue, is the biggest preventative health intervention that we can take. And unless we really also have a strong focus on mitigation in the way we talk about planetary health, then we can forget the whole point of adapting into the future.
So in closing, we have some key takeaways. We heard a rich array of insights, and all under the umbrella of planetary health: paradigmatic change, equity, justice, ethics, systems thinking, democracy, but also what planetary health as a concept doesn't exclude, and how we need to be aware of that, and how it may not make sense everywhere for everyone, and also punctuating the importance of being inclusive of Indigenous peoples and local communities in the work that we do, especially engaging stakeholders in this framework, and the importance of framing, of course. So I would like to thank everyone in this audience, our panelists and our moderator, and of course the hosts of the conference at Radboud University.